Hello, and welcome back to this episode of This Healthy Life podcast. I'm so excited for my guest today. I have Dr. Zachary Spiritos, and we're going to be talking about a topic that is so near and dear to my heart. We're going to be talking all about the gut-brain connection and how you can be experiencing neurological and mental health issues from your gut. And so he is a neurogastroenterologist, and he's also the founder of EverBetter Medicine, and he is here to share his wealth of wisdom on this amazing topic. So welcome. So happy to have you.
Yeah, thanks for having me. I'm psyched to be here.
Yeah, absolutely. So I'd love for you to start with a little bit of an intro about yourself and how you got into working in this particular space with the brain and the gut.
Yeah, so I'm a GI doctor. I went to Duke for fellowship and where I learned how to be a GI doctor. And then during my training, and then certainly after training, I became fascinated with kind of the brain-gut interaction. And so the patients that I see are those who deal with software problems. As a neurogastroenterologist, we generally deal with things that aren't really visible. So, for example, if you see a GI doctor and you're having complaints, difficulty swallowing, pain, diarrhea, etc., in all likelihood, you're probably going to get an endoscopy, and they may pair that with some imaging tests and maybe some blood work. And they're looking for hardware issues. So ulcers, cancer, Crohn's disease, ulcerative colitis, infections. And when all these are negative, then it suggests you may be dealing with a software problem, whether that's a nerve transmission problem that you're experiencing kind of heightened visceral pain or nerve pain that is transmitting signals from the gut to the brain, or a motility issue where the organs just aren't moving in coordination. That can cause a whole heck of a lot of symptoms. And that's what a neurogastroenterologist tends to do. And I'm fascinated with this world, and that's why I entered it.
Awesome. There's not enough about you either. So I shared a little bit before we got on the podcast, but I suffer from celiac disease and I don't get any GI issues whatsoever, but it's all brain and neuro stuff. And I just struggle so much to find someone that can actually help me in this area, because if you go to a regular GI doctor, like you said, they're just kind of focused on like the hardware, right? And like imaging, and they're like, oh, well, everything's looking good, so we don't know why you're having all these brain symptoms. And you go to someone else like a neurologist, they're like, well, I don't know why your gut's causing these brain issues. So you're kind of just left in this abyss with no one really to help you. So grateful for people like you to be in this space and sharing your wisdom and being able to help people like me. So thank you for that.
Absolutely. My pleasure.
Yeah.
I'm fascinated by the whole world, and I love taking care of my patients.
Awesome. So let's talk a little bit about the gut and brain connection. So like we keep hearing a lot about that, right? Like, people are like, oh, the gut's the second brain and there's such a connection with it. But what sorts of symptoms can people be experiencing if they're having some, like you said, software issues between their brain and their gut? I already know what mine are, but I want to hear what you experience with your patient population.
Yeah, I mean, so it's a variety. And so not only is the gut the second brain, but there's effectively a brain in your intestines. So we have our central nervous system, which is effectively our spinal cord and our brain. And then we have our enteric nervous system, which is a collection of very complex nerve endings that supply our gut. And it's spoken to by our gut bacteria. So our gut bacteria and cells in our intestines kind of sample the world, right? Like that's our body's way to understand what's going on, right? It's sampling all the things that we eat and come through our digestive tract. And that has a direct relationship to our enteric nervous system and sends signals there, which then propagate signals to our central nervous system. And so, not only do patients experience GI symptoms like nausea, pain, but also brain fog, anxiety, and they affect each other. So when our GI system isn't working so well and we experience constipation that is out of the norm or pain, that causes anxiety, right? And similarly, when we're anxious, that messes with our gut, right? I personally, if I'm giving a big talk, like I got to run to the bathroom, right? It's a TMI issue, but like when we're stressed, it has a real relationship on how our gut moves. Like they did this horrific study like 80 years ago. I don't know when the exact time was, but they took medical students and they did a colonoscopy on them unsedated. And then they were in there and they said, you have a cancer. And when they said that, their colon started to contract wildly, right? So that stress response has real effects on how our gut moves, but not only how our gut moves, but how we feel it as well. So there's something called visceral hypersensitivity, which means that everything is kind of working okay in your intestines. It's moving all right, you're digesting okay, but you feel everything a lot more. You feel those twists, those turns, the cramping, the burning when you otherwise shouldn't. And that's where the brain has a tough time turning off those pain signals. Like your brain really wants to know if you get bitten by a bear or you break your leg. It doesn't need to know about digestion. It just doesn't need to, there's too much important stuff going on in the world. You need to make sure you're not going to run into traffic and you're paying your bills on time. Your brain doesn't need to know about what's going on in your gut. But when we're really stressed and anxious, okay, and there's a breakdown in the gut brain communication, the brain has a really tough time turning off those signals. And that's called visceral hypersensitivity, and one of the core features of a condition that's commonly known as irritable bowel syndrome.
So all tied to the nervous system, right?
Yeah.
All these conditions that people are experiencing in their gut. And then let's talk a little bit about the vagus nerve. So I feel like so many people are talking about that, right? Like there's so many things for like nervous system reset and addressing your vagus nerve, but that's completely tied to how your brain and your gut are kind of communicating, right? Am I wrong there? Or
No, you're exactly right.
okay, so
Yeah.
let's deep dive into that a little bit because I don't think people have a very good understanding of how important that nerve is and what that nerve is doing and how that's connecting kind of your gut and your brain.
Yeah, so I think people are obsessed with the vagus nerve.
A little bit, right?
Probably an oversimplification of what's going on,
Hmm.
but we care about the vagus nerve being online because that's what propagates our parasympathetic nervous system. So we have our autonomic nervous system, which is uh, our everything that is done behind the scenes in our body that we don't control. Like we control our arms and our scent and our breathing to some extent. But the autonomic nervous system actually controls our breath as well, controls our heart rate, our sweating, our pain perception, uh, temperature regulation. It does everything behind the scenes. And uh, there are two big branches of the autonomic nervous system. There's a sympathetic nervous system, which is our fight or flight response. And then there's our parasympathetic nervous system, which is our rest and digest response. And we often find, this is not a really good way to test this, but we often find that people who have disorders of the brain gut interaction are living in this heightened fight or flight mode. They
Isn't
feel
that
everything.
everyone nowadays though? I feel like
Everybody's stressed out,
everyone's in some
right?
sort of fight or flight, right?
Exactly. And, it's not just that causes GI problems. There's also a breakdown. So it's not, I had panic attacks for 10 years and I didn't develop GI issues, but because there's something more than just stress and being in fight or flight mode that causes GI symptoms. There's probably an element of dysbiosis where the gut bacteria isn't healthy as it used to, increased intestinal permeability, or more colloquially is known as leaky gut syndrome. Um, but to go back to what we were talking about, the reason why people love the vagus nerve is because it induces rest and digest, right? It calms down our nervous system. It turns down those pain signals. It allows us to digest better and not run to the bathroom after we eat a peanut butter and jelly sandwich or going out to dinner. So that's why people have been talking about the vagus nerve. It's far more complex than just the vagus nerve. I think more properly we should call it the parasympathetic nervous system because that's really what we want to employ. And that's what we try to get online in a lot of these conditions, amongst other things, improving our gut health, removing antibiotics, eating more fiber, making sure our gut microbiome is healthy as it can be. Um, but yes, re-regulating our nervous system is a huge part of that. And obviously it's really tough. There's no magic for that, right? Some people, it's as easy as just getting better sleep, which is not certainly easier said than done, right? Sometimes it's getting outside, being around the people that we love. And then there's therapy. Hypnosis actually has really good data for irritable bowel syndrome. When I tell patients that, they're like, "That is nuts." And more often than I get a tremendous amount of pushback. But it really, really works because
That's
it
interesting.
manipulates our subconscious. And the way that we feel our gut, a lot of that is done beneath the level of consciousness, where, we get a pain and then all of a sudden we're like, oh my gosh, is this going to ruin my day? Am I going to go to the bathroom in front of everybody? Is this going to be the rest of my life? And then we kind of start to spiral, and hypnosis kind of untangles all of that. And it really, really works. So,
Yeah, because
yeah.
I can see that, like especially with like a gut issue, just in my experience. So, being celiac, I have to be so OCD about cross contamination and gluten, and I'm always stressed about it, right? So even though I'm like been celiac for 12 years and been gluten-free 12 years, like even though I kind of know the routine and like what to say and what to do, you still have that anxiety about every single meal that you're eating. And it could just be like underlying anxiety that's just keeping your immune system ramped up. And like same if you're having like GI issues, right? You're just like, if I eat, am I going to have to run to the bathroom, or like what's going to happen to my bowels, right? Like you're always on this kind of like subconscious stress of like what your actions are going to do, and your nervous system never really has a chance to kind of calm down and reset because you're so
Yeah.
hyper vigilant, right?
There's really good data that suggests that even after celiac is controlled, right, the antibodies go back to normal, the bowel looks fantastic, that there's a high prevalence of irritable bowel syndrome afterwards, that people still have lots of symptoms. And I guess we're not quite sure why. Is it because the diet changes induced by avoiding, gluten and maybe other things that you're avoiding? I don't know. Or is it like the hypervigilance that you continue to be on afterwards? Because you're just like, I am so freaking worried about kind of increasing my antibodies again and setting off this inflammatory cascade that it's overwhelming.
Absolutely. And then, so in your practice, I feel like it seems like everybody has some sort of gut issue, right? Whether it's like a neurological tied gut issue that maybe they don't even know is stemming from their gut, or actual like GI problems. So, what are some of the root causes or things that you're seeing common in your patients that are kind of setting off this cascade of gut issues and brain issues?
Great question. So we tend to put people into buckets. Like, is this irritable bowel syndrome? Is this like functional dyspepsia, which is kind of more pain up here? And one of the most important questions that I ask people is, when was the last time you felt normal? Because there's usually something that kicks it off, right? And so a common tale in irritable bowel syndrome is a massive GI infection that they were studying abroad, and they eat some street meat and it just kind of tore up their guts. And then ever since then, it hasn't been the same. So an infection is a big, uh, one of a huge source of people with chronic bowel issues. We know that trauma and stress play a big role in GI disorders as well. So it's very well validated and has been studied that show that acute traumatic events in childhood play a humongous role in development of disorders of the gut-brain axis, or conditions like irritable bowel syndrome. Um, um, Big surgeries, antibiotics, all can really play a role. So one of my jobs is to play a little detective work and kind of go back in time and say, like, let's untangle all of this. Because then once you get at it, then perhaps you can start putting together the pieces again. You'll know which buttons to press. In this world of chronic invisible conditions, a lot of it is trial and error. So we use pattern recognitions, and there is data, but it's less predictable. Like, your interventions are less predictable than like, your broken ankle, we're going to fix it. Like, this is a little bit more,
Guess
um,
and check kind of
yeah,
system, right?
exactly.
Try things out.
I've done this for a while, and
Yeah.
I've seen a lot of pathology and phenotypes, so I have a pretty good sense of what's going to work. But one of the things I tell my patients is, look, this is complex. Like, that's why you're here to see me. Like, usually they've seen 2 or 3 GI docs before they land in my office. And I'm like, this is complicated. I know this is complicated. Like, we're going to try some things. I'm going to touch base with you every 2 to 3 weeks, because we're gonna figure this out. We're gonna regain some sense of normalcy. It just may not be immediate because these things can be tough.
Yeah,
And a lot of
absolutely.
the things that we employ are, diet strategies, good sleep hygiene. Um, we use sometimes neuromodulators, which are kind of change the brain gut communication. They are traditionally antidepressants that we sometimes use that actually don't work for if someone has anxiety or depression. It use that to check both boxes, but they have real properties to kind of turn down pain signals in our gut and re-regulate our motility. And that's some people benefit from that. Psychotherapy works really well. A lot of patients have mast cell issues, like mast cell activation, so we may target mast cells. And so it all depends on how people present and what their story is.
Yeah. And then, so what sort of testing do you do when someone comes into your office? Is there certain testing that is kind of your go-to to help solve some of these things? Like, do you do stool testing, or are there certain blood tests or blood markers that people should be asking their doctor for to kind of dive into what might be their root cause? Or do you just do it more kind of on a clinical basis and guess and check and see what's going on?
Yeah, certainly the history informs what we'll be looking for. If you said, I got my gallbladder taken out and then my IBS kicked in, I was like, okay, that's probably related to that, right? And so, so the story always kind of informs where and what we test. A lot of people have already had a lot of tests before they come to see me, but rule number one of irritable bowel syndrome is you got to make sure it's irritable bowel syndrome. You got to rule out everything else. So that's small intestinal bacterial overgrowth, or SIBO. That's celiac disease. It's bile acid malabsorption, which is a diarrhea state that can happen after a gallbladder is taken up. That means Crohn's disease, really sneaky Crohn's disease that lives in the small bowel that's difficult to detect. That's mast cell activation syndrome. There's a lot of different conditions out there. Microscopic colitis. So, every condition affects a certain person. Like, microscopic colitis is a diarrhea illness that typically affects women in their fifth, sixth, and seventh decade of life. So if that person comes in, I'm like, more going to think along those lines. So it all depends on kind of who you are, your gender, your age, your history, your medications that you're taking. If you have a big autoimmune history, right? Like, does that make me think that you may have a Crohn's disease or a celiac disease or MCAS? Sure. So all of the data pieces inform where we go. I definitely don't apply a blanket approach to people, but it does start with some blood tests, right? We do look for celiac disease for a blood test, stools tests sometimes. If they haven't had an endoscopy, we'll usually do some form of endoscopy, but usually they've had that by the time they come to me.
Mm-hmm, mm-hmm. And then, so I'd love to touch on the mast cell activation. So I feel like that's such a big topic in all sorts of health. So in addition to celiac, I also had Lyme disease and mold and all sorts of other things. And in that community, there's a lot of buzz about mast cell activation. It seems that everyone with Lyme deals with some level of mast cell activation at some point in their kind of healing journey. So how is that presenting in the gut, and how is that affecting people with gut and neurological issues?
Okay, so let's talk about what mast cell is. All right, so mast cells are the cells that line every part of our body: our skin, our gut, our brain, our lungs, our heart, our vessels. They're ubiquitous, okay? And they're really, really important for us. They're here in our bodies for a reason, to help protect our gut barrier, to help with wound healing, to help fight infections and bacteria and viruses. They do really, really important things. In mast cell activation, something happens that kicks them off, okay? Whether it's an infection, a head injury, pregnancy, stress, trauma, and then COVID's a big one. It's kind of exploded after COVID. All of a sudden, they're reactive, right? So I kind of think of them as the neighborhood watch, right? They're supposed to call us when, there's someone sketchy outside, or, your garage is left open. But in mast cell activation syndrome, they're calling you when like there's a squirrel on your porch. Like, you just too much.
They don't shut off.
And exactly. And so the reason that, how I started treating MCAS is that I would see a lot of third, fourth opinions for irritable bowel syndrome. And not only would they have gut issues like diarrhea, bloating, pain, but they had symptoms everywhere. They have brain fog, fatigue, palpitations, skin rashes, itching, shortness of breath, sinus issues, dysfunctional uterine bleeding, pain with sex. And they were these young, otherwise healthy people, and they were seeing like 7 different doctors. They had a cardiologist, they had a neurologist, they had a dermatologist, they had an allergist, they had me. And we're like, what's happening here? Like, how this can't statistically be possible where someone has all of these different unique things like endometriosis, migraines. Like, it just doesn't make sense. There has to be something that is the common denominator here. And that's what opened my eyes to MCAS. And so that was about a couple years ago. And every complex IBS patient that's like refractory to care, 70% have mast cell activation syndrome. And so, the history leads away from something like irritable bowel syndrome and towards MCAS when multiple different organ systems are at play. Sure, anxiety and stress and some brain fog can come with IBS, but not the palpitations, not the endometriosis, not the skin rashes. Like, that does not happen with irritable bowel syndrome necessarily. And that's when my ears start perking up with mast cell activation syndrome, when multiple different organ systems are in play.
Mm-hmm. And there's not really any testing that you can do to see if you're dealing with mast cell activation, right? Like, it's kind of another one of those clinical diagnoses, or is there testing that you can do that kind of points to it?
Or is there? Yeah. There was, the traditional teaching was that we used a blood test called the tryptase. That test stinks for it. It's just not very sensitive. And so the guidelines have changed more recently to try and detect some of the mediators of mast cells. So mast cells secrete over 1,300 chemical factors. And so our tests There's a few tests out there that are fairly sensitive at detecting them. I wouldn't say amazing. The sensitivity I think lives at around 60%. So if 100 people have the condition, it's missing about 40% of those people. And so part of the diagnostic criteria is not only testing positive, but also response to therapy. So if my clinical hunch says this is MCAS and we've appropriately ruled out everything else, then I often just start therapy because therapy is effective and comes with very little side effects. And I'll do the testing as well.
Yeah. So what do you do if someone's dealing with mast cell activation when having GI and neuro issues? Like what sorts of treatments are there for that?
Yeah, I'll give you an example. So I had a patient who just moved from California. She's like 23. She comes in with her 4-year-old son, and she's had like 2 colonoscopies, all the blood work, capsule studies where they take pictures of the small intestines, just the gamut. But she also had brain fog and fatigue and palpitations and rashes. And we sent her for testing. Before I sent her for testing, I was like, I'm just really suspicious of mast cell activation syndrome. Let's just put you on therapy. And the first line, kind of the ground floor of therapy, and there's multiple layers that you can bake into this, is Pepcid or famotidine, which is an H2 blocker, and Zyrtec, which is an H1 blocker. And sometimes we have to choose different H1 and H2 blockers based on tolerance. People with mast cell tend to react towards everything. Although Pepcid is generally very safe, they may react to the excipients or the additives in that medication that aren't necessarily famotidine, which is the medication itself. So sometimes we have to rotate different medications. But in her case, we did Pepcid, Zyrtec, and in a week she's like, I have no symptoms. Doesn't always happen that way.
That's magic.
But it does happen for sure.
Yeah.
Or at least they see significant improvement in some of these symptoms. But that's always where I start because it's really well tolerated and low side effects. And then I always pair that with trying to identify what people's triggers are, which can be really tough. And I don't find, we talk about mold, right? How is there any mold in the house? We talk about certainly different foods, temperature changes, pressure changes, chemicals, things like that. And so I ask people to just be like really kind of self-detectives and identify what makes them feel worse. And then that's certainly part of the dialogue as well.
Yeah. Awesome. That's amazing. After a week, that's incredible, right? Especially for someone
I've
that's
never
been
gotten
struggling
like
with
that.
so much. Yeah.
Yeah,
Like
that was
that's
pretty
awesome.
epic. That was pretty
Yeah.
amazing. But I mean, I see several mast cell patients a day, and it's usually more complex than that. And they often have comorbid POTS, so we're treating their POTS at the same time, which is a condition called postural orthostatic tachycardia syndrome.
Yeah, let's talk about that because I feel like that's another one that's getting a lot of buzz lately, right? Like a lot of people are starting to deal with that, especially again, like in the Lyme community, so many people deal with that too. And it's always been kind of tied to like Lyme and mast cells. So I'd love for you to share a little bit about that and what that all entails and symptoms of it and what people can do for that.
Yeah, goodness, yes, that's really. I mean, these are complex issues, so I'll try to break it down as best I can. So POTS is a complex condition that has interplay with mast cell. Mast cell can make POTS worse, and POTS can make mast cell worse. So POTS stands for postural orthostatic tachycardia syndrome, and fundamentally, people have a tough time standing up. So they have orthostatic intolerance. So they stand up and they get really dizzy because their autonomic system, which we spoke about before, isn't working so well. So when you and I are sitting down right now, we have a pretty substantial amount of blood pooling in our lower extremities, just gravity. Okay. And when you stand up, your body has to do a lot of elegant maneuvers to make sure blood shoots back up to our heart and our brain so we don't pass out. People with POTS can't do that very well. So they don't get enough blood to their hearts. So the heart is receiving less blood volume. And they're like, oh my gosh, I got to get more blood to the brain or we're going to pass out. So it starts beating really fast as people just get tremendous amounts of tachycardia and palpitations. And then because they don't perfuse their brain very well, brain fog, fatigue, nausea, amongst a whole host of other symptoms. And that dysautonomia can make mast cell worse, and mast cell can actually make POTS worse. So in every patient who has POTS, I'm always screening them for mast cell. And conversely, if you have mast cell, I'm going to screen you for POTS as well.
And then, so let's talk a little bit about the microbiome. So how does that impact, the brain, right? Like obviously, like depending on what kind of bacteria and like microbiome you have, you're going to have different symptoms if you're missing certain things that are important there, right? So what's the connection between that and what can you do to kind of optimize your microbiome to also help your brain?
Yeah. So we know that the microbiome is very, very important, right? Probably plays a big role in um, the development of allergic reactions and autoimmunity and potentially mental health conditions. I do think a lot of these conditions are multifactorial. There's a lot of things that are baked into this, like genetics, hormones. Like I don't think anything exists in a vacuum. I don't, we're in the infantile stages of understanding the microbiome's role in all of this. Um, but the majority of our serotonin is synthesized in the gut, right? I don't think we can ignore that, right? And so we do know that the microbiome is very important, and that when we study people with IBS, anxiety, depression, all these conditions, that their microbiome is off. I always ask myself, like, is it off because it's causing these things, or is these things causing the dysbiosis, or do they evolve together? So we don't really know yet, and we're not savvy enough to pull specific levers in our gut microbiome to optimize clinical conditions. I can't say you have anxiety, we're going to put you on this probiotic, and you're going to go a lot better. Like we're just not there yet. Okay. There have been studies that show that probiotics work for a variety of things, like prevention of antibiotic-associated diarrhea, and they can help with IBS. And I sometimes use them as part of the puzzle, but I don't think they're the whole issue. Like they can't fix everything. But so yes, and just one more thing about probiotics. So yes, useful in certain clinical situations as part of a bigger picture of treatment. Um, I I don't think they stick very well in the colon. I think they are passerbyers, and they come and offer very beautiful, amazing compounds to our colon called postbiotics to feed our colon. But I don't think they take up residence in our colon very well. And yeah, so I don't think you take them and then your microbiome is changed forever, right? So how do we take care of our gut microbiome? And I said that because I just don't think probiotics are the answer for that. Um, so yes, so diet is number one, right? Um, Fiber fuels our colon, and it helps with cultivating a beautiful gut microbiome. And multiple different types of fiber is what is best. So fruits, vegetables, legumes, whole grains, the whole smorgasbord. The more you can get in, the better. Um, some people get really gassy on fiber, and I get that. And so that means that we may have to change your fiber or lower it down and reintroduce it gradually. Um, Also, if you have like some underlying pathology like celiac disease, or you're really constipated, that fiber can make you even more bloated. So I hate to say just eat more fiber and you'll improve your microbiome, you feel better. Like I think it's a little more nuanced than that. But if you're asking me if I could do one thing to improve your microbiome, it's introducing more fiber into your diet. Um, Alcohol is probably a big um, negative factor, and kind of inhibits the growth of multiple beneficial bacterial strains. Stress plays a big role. So, but saying the word avoid stress is probably the
I
dumbest thing.
know, probably makes
Yeah,
everyone even more stressed out, like trying to
it's
avoid
like,
stress, right? You're just
what
like
does that mean?
automatically
So
more stressed.
exactly. So I hate that phrase, but when you break it down, it's doing the things that make you happy. Get good sleep. We are really bad sleepers, right? We're always on our phone. There's always lights on, and no one is sleeping well. So that's obviously very fundamental here. Exercising, right? Like I don't introduce it as my first part of my plan for all my IBS patients. I really like, what are we doing for exercise these days? Or just getting outside, going on a walk. Um, yeah, and we find a lot of these patients with IBS have low vitamin D levels, and I've had a few cases where you replete the vitamin D, and a lot of things get better, and that's just we're not outside,
Yeah.
right? So
People are
we
so afraid of the sun now too. It's like it's okay to get a little sun. Don't be so afraid of
absolutely
it.
we're supposed to be outside,
Yeah.
and so yeah, I think caring for microbiome is very important, and the way I'll do it is through diet and lifestyle.
Hmm. Okay. Awesome. And then, so chronic gut inflammation and just inflammation, systemic inflammation is also such a big thing right now, right? Like everyone is so inflamed from a variety of different sources and factors. And so, how is that inflammation that's kind of starting in the gut or happening in the body affecting the brain and your cognitive function? And what can we do to kind of bring down some of that inflammation that our body might be experiencing?
Yeah, I guess the question is why we're so inflamed.
Yeah.
You can always
Million
go,
dollar question, right?
yeah. That's why I always ask people, like, when's the last time you felt good? Right? And are you inflamed because the diet's not great? Are you inflamed because of trauma? Are you inflamed because of a prior infection? And now there's dysbiosis, right? And your gut microbiome isn't as healthy as it should be. Inflammation is a tricky topic because it's such a broad term for such incredible complexity in our bodies. And so, um, you know, uh, an autoimmune inflammation can come in so many different types, right? There's autoimmunity, there's infections, there's just chronic inflammation, like something like irritable bowel syndrome or celiac disease, right? So sometimes it takes diagnostic evaluation to figure out what it is. And so there's not really like a one size fit all approach here. But it's, understanding if there's any like heart pathology there, like celiac disease, that we could reverse through dietary changes. And then it's building a strong structure, right? It's eating well, sleeping well, being with our loved ones, getting outside,
It's all the
exercising. And
foundation.
right, like I don't
Yeah.
think, you go on, I'm kind of new to this whole social media world, and there's a lot of quick fixes like this supplement, if we do this and we do these glasses and this, we weren't meant to wear those funny glasses. We weren't meant to take those supplements. We were meant to exercise and get outside, right? Like our bodies were meant to survive and thrive in a certain environment. It is not this environment inside in front of a computer or a phone all day. So
Mm-hmm.
going back to the basics and
Mm-hmm.
not overthinking it.
Mm-hmm. Yeah, not stressing yourself out more, right?
Right. Yeah.
And then, so what are your thoughts on, there's a lot of those kind of at home microbiome tests now, right? That are just like, hey, do this test. We'll tell you how your gut's doing and where your inflammation is and what foods are good for you and what foods aren't for you. What's your kind of vision or thoughts on those? Like, do you think those are helpful for people that are kind of just starting on their journey, like trying to heal their gut and trying to figure out like what foods are optimal for them? Or are we not quite there with the science that going down that route might make you spend a lot of time and money on doing something that's not necessarily going to help you?
Yeah, I think there's two things I'll say about that. One is that if GI doctors could know what's in your gut and fix it, we would use it. Those tests just aren't reliable,
Yeah.
right? Like they're just not an accurate representation of what's going on and how they crosstalk with each other, right? And there's with every test that needs to a good test is accurate and reliable. Okay, reliable just means that if a couple different companies use that test or use a microbiome test, it's the same answer. But if you go to four different companies that test your microbiome, you're going to get four different answers. Okay? Also, we don't know how to fix that, right? And we don't know what a healthy microbiome looks like. We know what healthy bacteria are and what detrimental bacteria are, but we don't know what Erica's microbiome was supposed to look like, right? It's like saying, Erica, you look better if you had my haircut, right? It's your microbiome is going to look different than mine. It's going to look different than Jeff's from Wales, right? And so we don't know what your healthy bacteria should look like in the context of your hormone profile, your age, your gender. And so not only are the tests not necessarily reliable, but we don't know how to manipulate it properly. I can't say take this probiotic and you'll be good, or eat these foods and you'll be good. We're in the infancy stages of understanding that. So I, and I will say that the people that study this the most, right, the microbiologists and the scientists that are really studying the microbiome, they don't endorse this either. So when you have the people that know the most about this and are telling us that this tests are inherently unreliable, I think it probably
Mm-hmm.
means something.
Mm-hmm.
And
Plus, you
so
don't know what's like introducing whatever strain they're telling you to take is going to do to the rest of your microbiome, right? Like, is it going to improve it or is it going to make things worse and more unbalanced? Like, I don't think
exactly,
anyone
like
really knows.
if you're going to run a study, it's saying, okay, Erica, you came in with bloating, and I think it's your microbiome. Let's test that, okay? So I run your microbiome, okay, and then I say, oh, you're deficient X, Y, Z. We're going to do these things, and then see how you feel, and then we're going to test your microbiome, and if you're feeling better, and we'll test your microbiome, and it's better, then that is a a proven method, not a proven method, but it substantiates that protocol for helping your symptoms because we helped your microbiome, and those tests just aren't there. So the theory is really nice, really, really nice, but it's a lot of money and a lot of stress and anxiety about numbers that I don't even know how to interpret. Like people come to me with tests. Like, this isn't just because I can run something doesn't mean the number I get means anything. And so that's why the tests that we tend to use, albeit imperfect, I know exactly what all those tests mean. That I know the sensitivity, which means that how good the test is in picking it up. I know the specificity, which means that how good the test is at ruling it out. And I know that for every test that I use. And we just don't have those values for those kind of tests. And that's where it's so tough to understand. And so what I say is, I don't think you need a probiotic to fix this, right? I think we need to eat healthier, sleep better, get outside, all the things that
All
we
the
spoke about,
foundations,
right?
yeah, all the things
Yeah,
we've
we
talked
forget
about.
that. we just forget that, and we're hoping that there's something out there, some magical
People want a
button
magic pill,
press,
right? Like a magic
bingo,
probiotic that's going to fix all their gut issues, and it just doesn't
or
work
a
that way.
liver cleanse or something. And it's just like,
Yeah.
it doesn't. I wish it was that easy. And I promise you, I love data. Like, I get all the data points that help. I get all the mast cell mediators. I get all the data that I need to make the proper clinical decision, the proper clinical decisions that we need to make you feel better. And goodness, I wish there was a reliable microbiome test that I could utilize, because it could be so helpful. We're just not there yet.
Not there yet. Yeah.
Yeah.
I've had other experts on in the GI space, and they've all said the same thing. So someday, right? Hopefully we're close to it, that it can be another set of diagnostic tools that we can use to help inform and make decisions and help people too. But yeah, I agree. They've got a long ways to go, right?
Yeah.
Yeah.
And it doesn't tell us what's going on in the small bowel too. Like, we can't forget about that. There's microbiome there as well.
Absolutely. And then another topic that has been kind of up and coming, I feel like, for the past 5-10 years is fecal transplants. There's been a lot of amazing stories that people are like, oh, I had C. diff and it completely cleared out my infection and I'm totally normal, or other people that had other sort of GI issues doing one. What's your kind of thoughts and perspective on this? And is it something that you've ever had included in your practice?
Yeah, so I've used it for C. diff. And it makes sense for C. diff, because C. diff is a weed, right? So I have C. diff. I 100% have C. diff, but I have a healthy microbiome. So that weed can't grow if the microbiome, this lush grass, won't permit that weed to grow. But when you're on multiple antibiotics, I have a patient who has chronic UTIs, and she was on antibiotic after antibiotic after antibiotic, completely killed her microbiome. C. diff flourished, and we treated it with antibiotics, because antibiotics tend to work really well. But you kill the weed, but then unless the microbiome is flourishing around it, the weed will just grow right back. And so that's when you give someone else's microbiome, or a fecal transplant, to make sure that weed doesn't grow back. And so for that purpose, it has been well validated, and it works really well. We actually, when I was in fellowship, we used to do a colonoscopy and actually squirt poop
Wow.
in the colon. Wild. For someone who was really sick.
Wow.
Now it comes in a pill form, so it's a little bit more palatable. I think you're still swallowing it, so, but it is there's no smell, because it gets to the colon, right? It's not opening up in your stomach; it's getting to your colon, where it needs to do its magic.
And then, so how fast does that work? So say you do have C. diff, right? And you've tried everything, nothing's working. So you're trying to do this new approach, kind of upgrading your microbiome with someone that's healthy. How long does it take for that to kind of integrate into your own microbiome and start making a shift in your body?
Yeah, I mean, so it's pretty quickly, but it doesn't treat C. diff.
Okay.
It is an adjunct to C. diff.
So you would still do antibiotics with the healthy microbiome.
Exactly.
But aren't you just killing off the microbiome that you just planted with the antibiotics?
Yes, well, 15 years ago, for sure.
Okay.
So we now have targeted antibiotics. So we used to use medications like metronidazole, which is a pretty broad spectrum antibiotic that, you're right, would kill everything. But we have made advances to where we use medications like Difficid or fidaxomicin that is pretty darn specific to C. diff.
Okay. And then on that topic, actually, since you just kind of mentioned that, so, sometimes it's inevitable and people have to take antibiotics for whatever they might be dealing with or having surgery or whatever it is. What should you do to kind of help your gut after that, so you don't end up with infections? And obviously, you don't want to just take these random probiotics, because we just talked about how that may not be the most ideal situation. So what should someone do to kind of reset their gut or heal their gut after antibiotics?
Yeah, actually, in that situation, I think taking a probiotic is
okay.
Yeah, and there are good, there's great resources online for specific indications for probiotics and avoiding antibiotic associated diarrhea, and dysbiosis afterwards. I think that's a fine, indication to taking a probiotic, mainly because it's finite. You'll take the probiotic, while you're on antibiotics, for a few weeks afterwards, and that's kind of it. Where I don't like using probiotics is just for a condition where it's I'm not sure how long you're supposed to be on this for. We just continue it and that's it. Is it a set and forget it? And at a price of $50 a pop, that's not really palatable. And so I will employ it for that. I'll concede that for sure. But you can also eat fermented foods. Fermented foods are kind of natural probiotics that,
unless you have mast cells, right? That can kind of aggravate mast cells a little bit, right?
it is a big histamine load.
Yeah.
Right? So if you have histamine intolerance or mast cell, like that's different, and that's a fine line right there for sure. So there's always a there's
There's always
always
a
a
catch, right?
there's always a catch, right? So that's a little different. Perhaps a probiotic in that situation
Yeah.
would be best for someone with mast cell activation. So
Yeah.
you're completely correct. Yeah, fermented foods, kimchi, sauerkraut, kefir, cultured yogurts, all a really nice option in that situation.
Awesome. All right, so we've talked a lot about all the things that can go wrong and, all the symptoms of the gut, but I'd love for you to share like a story or two that's been like an amazing success story. I know you shared the one about the girl that kind of recovered in a week, but would love to hear like another standout story that you've had in your practice that really turned full circle with the recovery.
Yeah, that's a really good question. So, yeah, the mast cell ones are always pretty spectacular because they have been gaslit for so long, and they see so many providers, and they're on a bunch of medications, and they still don't feel quite right. Like, I think deep in their gut, they realize that something is still off, and they haven't really figured it out yet. And they'll tell you that. They're like, there's something there. And then once you say, I think I know what's going on, I don't know for sure, but I have this hunch, their eyes just brighten because, like, are you kidding me? Like, could there be? I think it's just so validating, right? They're on an antidepressant for stress when they don't feel quite anxious or stressed. That they're on a beta blocker for their heart, and they're like, why does my heart just race? Like, they don't have an answer. They just have symptoms. Um, so recently I had a patient who had a lot of kind of same old story, a lot of different providers. And we started her on therapy, and she started getting a little better. But what was a really distressing symptom was that her hair was falling out. And she had all the vitamin, the nutrient tests were coming back normal, the thyroid tests were coming back normal, no adrenal insufficiency, anything like that. And then we took a mast cell stabilizer and we put it in her shampoo,
Wow.
and it worked.
No way. That's
Yeah. And so
crazy.
this is the trade for folks who treat MCAS. This is not, I didn't make this up myself. But it was one of those things that even when I was saying it, I was like, this is nuts, right? And she's like,
Yeah,
this
sounds
is nuts. I was like,
crazy.
I know this is crazy. And it worked.
Wow.
And that was pretty
That
spectacular.
is amazing.
Yeah.
Very
But
cool.
there's always wrinkles to this, right? And there's setbacks. And, but one of the, it's incredibly validating getting a diagnosis. And when they finally have something to cling on and they have a support group they can join, right? It changes everything. Even if they say, hey, look, my symptoms are like 40% better. The fact is like, hey, I looked up online and there's a whole community of people just like me. And I can hear their testimonials. They get better. I can get better. And hey, I started taking this DAO enzyme because I read about it and I heard it worked for them and we have similar symptoms. So I started trying it. So it starts to empower them once you have a diagnosis. So that's always a beautiful thing to see. And that really fills my cup up personally because it's fun to embark with them on that journey.
Mm-hmm. Awesome. And then you're starting your own practice. You have EverBetter Medicine that you're starting. And so can you share a little bit about that and what that's going to be like to work with you?
Yeah. Thank you for allowing me to shed some light
Yeah,
on that.
absolutely.
So I find that, I treat a lot of chronic invisible conditions where people are just kind of putting together their health on their own. And there are other physicians like me out there, but we're kind of few and far between. And we're often at academic centers where it's really, my wait list is 6 months plus. And you have to be in my area, right? Like, what happens if you're not? What happens if you're in rural Western North Carolina? I'm in North Carolina, by the way. And so I wanted to create something that was accessible for people dealing with these conditions that don't quite make sense to them or potentially their care teams as well. So it's a telehealth based practice where, yes, we're prioritizing accessibility and helping kind of unravel the mystery of your illness. So I treat complex digestive conditions, everything from why can't I swallow to goodness, I'm burping too much, or I am always nauseous. I'm going to the bathroom in the middle of the night, to dysautonomia, so POTS, and I treat MCAS as well. And there is also another division of our group, which is weight management too, where that takes a very similar approach, where they spend a lot of time with you. And similar in my model, we spend lots of time with you as well, with very frequent touch points in these complex conditions. It's never a set it and forget it. It's not, hey, start this therapy, I'll see you in 6 months, and
Right. Yeah.
it doesn't work that way.
Uh,
So I, with all of my patients to this day, we have touch points every 2 to 3 weeks to see what's working, what isn't working. So in the weight management world, he does something similar. A lot of time to understand why it's been challenging to lose weight. Certainly, he employs some of these medications like the GLP-1s, Ozempic, Mounjaro, et cetera, but it's more than that. It's a whole body approach to weight management because we want to set you up for success for life, as opposed to just waiting for that next prescription of
yeah, just losing the weight and then having it all yo-yo back if you come off that too, right? So trying to
Yeah.
get down to the root cause of what's setting your body into that inflammatory weight gaining state.
Yeah, exactly.
Awesome. Well, thank you so much. And if people want to find you and learn more about your practice, what's the best place to find you?
Yeah, my Instagram is Dr. Zach Spiritos. And if you search EverBetter Medicine, you will find us on the internet.
Awesome. And we're going to link to everything in the show notes as well. So thank you so much for all of this. Really appreciate you.
Anytime. It was a pleasure.
Thank you.